Well, it's a first for our region.
A robotic-assisted kidney transplant was performed at UTMC earlier this month. 13 ABC's Lisa Guyton joining us with this remarkable story, a story you'll only see right here.
It's hard to believe when you see him today that less than 3 weeks ago, Amadou Diallo had life-changing surgery.
Every day go by and I get better and better.
Amadou was diagnosed with kidney disease several years ago and ended up on dialysis every day.
Before I was sick and I was very active. I was playing soccer and taking my kids to the zoo and swimming pool. But once I was diagnosed with kidney disease, and when I was told that I'm going to start dialysis, I was very devastated. And when I started dialysis, my activity was very limited.
The kidney Amadou received came from his wife. He says there are no words to express his gratitude.
And she told me that we are a family, and she's a part of me, and I'm part of her.
Amadou is a nurse in his home state of Indiana. He's excited to be getting back to everyday life at home and work.
I'll be able to drive and do my prayers and my normal activity coming, and my life is getting normal. I'm feeling great.
Dr. Obi Ekwenna performed the robotic transplant surgery alongside a surgical team.
This minimally invasive technique allows us to really help a lot of patients to enhance what we're doing and potentially provide better outcomes.
Dr. Ekwenna says robotic-assisted kidney transplants help reduce the risk for infection, speed up healing time, and often mean less pain.
Just to have another way of helping our patients is incredible. That's really what drives this.
And he says Amadou is a great example of how life-changing this revolutionary procedure can be.
He's doing remarkably well, a couple of weeks after the procedure, and his kidneys working, and that's the beauty of what we're doing, and that's the miracle that's associated with it.
Dr. Ekwenna hopes this first is the first of many robotic-assisted kidney transplant surgeries at UTMC.
Kidney transplantation is transformative. It gets a patient from, the bondage of being on dialysis to sort of a renewed life.
Lisa Guyton, 13 ABC, Action News.
And Amadou and his wife went home to Indiana today. He wants to pay it forward by volunteering his time in the future with kidney patients.
Quite a man. Robotic-assisted kidney transplants are being performed at a handful of hospitals around the country. Other than UTMC, procedure only being done in our region at the Cleveland Clinic and the Henry Ford Hospital in Detroit.